Good afternoon. My name is William Stasinis, and I'm a student physical therapist here at Rocky Mountain University. And today we'll be applying non-thermal ultrasound to our patient Ronnie here, who experienced a lateral ankle sprain about 2 days ago. Because the injury was 2 days ago, Ronnie is in the inflammatory stage of healing, making this an acute injury, which is why this is non-thermal. Indications for this modality include stimulation of tissue healing and fibroblastic activity, pain control, decrease of muscle spasms, decrease of muscle guarding from the patient, and to decrease swelling or edema in that area. And this works for acute and subacute pain. Contraindications for this modality include active cancer, implanted electrical devices, seizures, disorders such as cardiac abnormalities, and areas of impaired sensation. So with that said, do we have any known active cancers?
No, sir.
Do you have an implanted medical device?
No, sir.
Okay. I know from our patient history that we did have some cardiac abnormalities a few years ago, but that is a regional contraindication for this modality. So because we're working on that lower extremity down here, it's not something we have to worry about because we're not in the area of that heart. Okay?
Okay, thank you.
Awesome. Do we have any impaired sensation in this area? Can you feel your ankle relatively well? Feel our toes? No
Yes.
numbness or tingling in that area?
I can feel things down there. No numbness or tingling.
Perfect. All right. So with that said, now we can set up our ultrasound machine to begin our modality. So first, we have to turn it on. All right. All right. So sound, we'll be using 3 megahertz of frequency, a 20% duty cycle, and an intensity of 1.5 watts per centimeter squared. And then we can perform this modality for 5 to 10 minutes. I will set our timer for 8 minutes. And before I start the modality on the ultrasound machine, I do have to apply the conducting agent to the area that we're treating. With that said, is it okay if I apply this gel to our lateral ankle?
Yes, please.
Okay, and do you understand the purpose of why we're doing this modality?
Yes.
Okay, perfect. All right. This gel might be a little cold. All right. And then before I start our ultrasound machine, I do have to make sure our head is in contact with the area that we're treating in order to ensure we're not damaging the crystal inside the head. The ERA for ultrasound is about half the size of the ultrasound head that we're using, and the area of treatment is about 2 to 4 times the size of that head.
So you'll have people who just like, I guess, basically, sometimes it feels like competition, sometimes it feels just like, yeah. What's your name? Yeah, they don't know. It just depends. But yeah, so,
Right. So our 8 minutes are up, and I do have to ensure that our ultrasound machine is off before I remove the head for application. How'd that feel?
Felt really good.
Okay, awesome. Now we'll remove the gel from the patient, and we always reassess the area that we're treating to make sure that there was no redness or significant irritation or increased swelling in that area.